Imagine your child suddenly complaining of severe stomach pain, and you're left wondering if it's just a stomach bug or something more serious. What if I told you that these symptoms could be a sign of a condition that's becoming more common in children: gallstones? Yes, gallstones, often associated with adults, can affect kids too, and the numbers are on the rise. This isn't just about discomfort. Untreated gallstones can lead to serious complications. So, how do you know when to seek help, and what can you do to protect your child's health? Understanding gallstones: what are they and why do they form? Gallstones are hard, pebble-like formations that develop in the gallbladder, a small organ that stores bile, a digestive fluid that helps break down fats. Normally, bile does its job without causing any issues. But when certain digestive fluids accumulate and harden, they can form gallstones. In children, gallstones often form due to an imbalance in substances in the bile. For example, cholesterol gallstones occur when there's too much cholesterol for the bile to dissolve. This is the most common type in adults. On the other hand, children are more likely to develop pigment gallstones, which form when there's an excess of bilirubin, a substance produced when the liver breaks down red blood cells. While gallstones themselves aren't always harmful, they can lead to serious problems. If a gallstone gets stuck in one of the ducts that transport bile, it can cause pain, inflammation, and even damage to the liver or pancreas. This is why it's so important to recognize the symptoms and get the right treatment. Why are gallstones becoming more common in children? It's alarming to learn that the incidence of gallstones in children has been increasing. In fact, studies suggest that the number of children with gallstones has risen by as much as 4% in recent years. But what's causing this spike? One of the main culprits is the rising rate of childhood obesity. As more children struggle with weight issues, the risk of gallstones increases. Obesity can lead to higher levels of cholesterol in the bile, making it more likely for gallstones to form. But obesity isn't the only factor. Certain medical conditions, like cystic fibrosis, thyroid disease, and hemolytic diseases, which affect the blood, also increase the risk. Genetic factors play a role too. If gallstones run in your family, your child might be more susceptible. And let's not forget diet. A high-fat diet can contribute to the development of gallstones, especially when combined with low physical activity. Signs and symptoms: when to worry. The tricky part about gallstones is that they don't always cause symptoms. Many children with gallstones might never know they have them because they don't experience any discomfort. However, when symptoms do appear, they can be a sign of a serious problem. One of the most common symptoms is abdominal pain, especially in the upper right portion of the abdomen. This pain can be intense and often comes in waves. It might radiate to the right shoulder or back, making it difficult to pinpoint the exact source. Some children also experience nausea, vomiting, or diarrhea along with the pain. Another warning sign is jaundice, which causes the skin and eyes to turn yellow. Jaundice occurs when a gallstone blocks the bile ducts, leading to a buildup of bilirubin in the blood. If you notice dark urine or yellowing of the skin or eyes in your child, it's a clear signal that something is wrong. In some cases, a child with gallstones might develop a fever, particularly if there's an infection in the gallbladder or liver. If your child is guarding their abdomen, tensing their stomach muscles to protect against pain, it's time to seek medical help immediately. When to seek medical attention. If your child suddenly develops intense abdominal pain, especially after eating, don't ignore it. Pain that comes in waves, particularly in the upper abdomen, could be a sign of gallstones. If this pain is accompanied by jaundice, it's crucial to get medical attention right away. Gallstones can also cause complications like pancreatitis, an inflammation of the pancreas that leads to severe abdominal pain. Symptoms of pancreatitis include intense pain, nausea, vomiting, and pale stools. If your child shows any of these signs, head to the emergency room without delay. Even if the symptoms are less severe, like intermittent stomach pain or frequent vomiting, it's still important to consult a doctor. Gallstones can be tricky, and early detection can prevent more serious problems down the road. Diagnosis and treatment options. Gallstones are often discovered during tests for other conditions. For example, if your child is experiencing unexplained stomach pain, a doctor might order an ultrasound or other imaging tests to check for gallstones. If gallstones are found but aren't causing any symptoms, treatment might not be necessary right away. However, if your child is experiencing symptoms or complications, a doctor will likely recommend surgery to remove the gallbladder. While the thought of surgery might be scary, it's important to know that gallbladder removal is a common and generally safe procedure. The surgery is usually done laparoscopically, which means it involves small incisions and a quicker recovery time. In addition to surgery, some children may need other treatments, such as fluids, antibiotics, or medication to manage complications. In more severe cases, a hospital stay might be required to ensure your child's safety. Preventing gallstones, what you can do. While you can't control every factor that contributes to gallstones, there are steps you can take to reduce your child's risk. Encouraging a healthy, balanced diet is one of the most effective ways to prevent gallstones. This means promoting plenty of fruits, vegetables, whole grains, and lean proteins, while limiting high-fat and high-sugar foods. Regular physical activity is also key. Exercise helps regulate weight and keeps the digestive system functioning smoothly. Even simple activities like walking, biking, or playing sports can make a big difference in your child's overall health. If your child is at higher risk for gallstones due to family history, obesity, or other medical conditions, it's important to work with your healthcare provider to monitor their health closely. Regular check-ups and open communication with your doctor can help catch potential problems early. Conclusion: protecting your child's health. Gallstones might not be the first thing that comes to mind when you think about your child's health, but as we've seen, they're a growing concern. By staying informed and recognizing the signs, you can take proactive steps to protect your child from the complications that gallstones can cause. If your child shows any symptoms of gallstones, don't hesitate to seek medical advice. Early detection and treatment are key to preventing more serious health issues. And remember, promoting a healthy lifestyle with a balanced diet and regular exercise can go a long way in reducing the risk of gallstones. Your child's health is precious. By staying vigilant and informed, you can help ensure they grow up healthy, happy, and free from the pain of gallstones.